All right. Well, before we get started, we do, of course, want to take a quick second here to thank all of our generous sponsors at Woodhull. These are our sponsors for our Sexual Freedom Summit 2021 virtual edition. And those sponsors are Enjoy Toys, Walters Law Group, and the U.S. Human Rights Network. And we would also like to thank, of course, SMYAL for partnering with us on this portion of our Sexual Freedom Summit. But yeah, let's go ahead and get started. I'm ML. I am the Director of Operations for Woodhull. And of course, this is the next joint program between SMYAL and us. We have partnered to highlight LGBTQ+ youth leaders from across the country so that we can provide them with a platform to really showcase their work. And so we welcome Camila Barrias to dive into the topic of self-care. She'll be chatting about its history and what it can look like amidst a pandemic, and then also navigating grief, and then how to not fall for corporate self-care. So welcome, Camila.
Hi, thank you for having me, everyone. I'm just going to share my screen. And a little bit about me. I am a junior at St. Mary's College in Maryland. I also am a substitute teacher for Montgomery County Public Schools, and I plan on teaching there when I graduate. But yeah, that was a wonderful introduction, so thank you. As was mentioned earlier, I'm a peer health fellow with SMYAL, as supporting and mentoring youth advocates and leaders. So this is just a little bit about who we are and what we do. We work a lot with, well, obviously youth, and also like provide resources and like after school activities. We have like an activist camp in the summer. Let's see, for some reason it's not letting me. There we go. Okay. These are some of our programs, and you can always find the rest of our programs on our social media, which is listed here, and there's a link. And we do have a scholarship for youth leaders as well, if you know any people in your life that you might want to tell that about. One of them I actually went to high school with. He's in this picture, Jonathan. And Jack, I know Jack too, so yeah, but this is not relevant to us. All right, so I wanted to talk a little bit about self-care. You might have heard about it, especially in the media, and it's also become kind of like a trendy word, kind of like how yoga was like the trendy thing like years ago. I mean, it still is, but there are certain things that kind of go in and out of fashion, if you will, in terms of like health and wellness and things like that. And now self-care is kind of having its moment. And I wanted to kind of talk about how to really understand what it actually means and implement that like in your life and maybe in your workplace, your environment. So its history is actually pretty rich. It was kind of like a medical term circulated in the 1950s, but it wasn't really popular at the time. But the phrase was kind of like adopted and popularized by the Black Panthers, actually. And basically for them, self-care was a tactic to rest and recharge in order to continue organizing. And also when people would get arrested, these were like yoga, meditation, and things like that were activities that they would do to kind of maintain their mental health while being held in the prisons. And Angela Davis and Erica Huggins were really the people that kind of pushed this and helped to popularize self-care. And Audre Lorde also kind of put the term into a little bit more into the mainstream when she wrote her book about being diagnosed with cancer, and she talked about self-care in terms of self-preservation and basically trying to stay alive. It really was more of a survival method, if anything. And that tradition of self-care and organizing really continues to today. I put a little graphic here from Occupy DC. They're a group that does a lot of organizing in Black Lives Matter Plaza, and they do these little self-care nights. Like they have sunset yoga. This one here is midnight yoga, and it's basically a place for the organizers to go and like relax and recharge, because obviously it's very heavy work. And so here's a little bit about corporate self-care, because anytime something gets popular, obviously people want to capitalize on it. So self-care can be completely free. You do not have to buy anything like a face mask, or I saw an ad for lotion the other day calling it like the ultimate self-care. You do not need to spend any money on taking care of yourself. And I love this little graphic here. It says, whenever you start to feel bad about yourself, remember that somewhere in a fancy corporate office, a rich man is happily profiting off of your insecurities. So I think that's a good thing to always remember. Whoops, went a little too far there. Okay. So really try and look out for that kind of language. And I also put there that self-care may not always be something that we want to do. It could be things that are hard for us, or things that we're putting off, like cleaning, or maybe eating vegetables, doing little things like that, that really could help you and your mental state, your physical state, but that we aren't always able to do, or things that we might be putting off. And so self-care is especially important right now as it relates to the pandemic, because we are all kind of going through like this collective trauma that we've never really had to face before, unless you were alive for like the 1918 Spanish flu or something, which my cousin's grandmother actually was. She turned 105 like a couple weeks ago. So, but yeah, so here I wanted to talk a little bit about, a lot of people kind of don't understand that living in a pandemic is a lot like, even if you haven't personally lost somebody in your life, we are kind of mourning something collectively, which is the loss of our previous lives and what things were like prior to the pandemic. So navigating grief and change is a really important thing to remember. And you kind of need to treat yourself as if someone, and I'm sure like many people's loved ones have also died, but you should really be treating yourself as if you've experienced a loss, because in many ways we have, and it does take a toll on us mentally and physically, and we may not realize it. And I think if you are in charge of like a workplace environment or something like that, there is only so much that your own self-care can do, right? It really also helps if we as a community acknowledge the importance of self-care, and you make your work environment welcoming of people needing to take time for themselves, people needing to do less, or like if you notice someone who's struggling with a task, maybe one day saying, you know what, I can take care of that. It seems like you need a break, or because self-care is also taking care of others, so that all of you can just collectively do better. And I think that helps everyone when everyone in an environment is working together to create that climate. So I wanted to do this little activity as an example of what I mean when I'm talking about self-care. So the small everyday things that you could do for yourself that don't cost money, things that you might normally not think are self-care. I want you to make like a small list for yourself. You don't have to share it, but if you want to share something in the chat about one of these things that you might want to do for yourself, I think that would be cool. So something that I put, these are the things that I put in my list. I said I want to start taking my allergy medicine, which I have. It's been going great. Eating more vegetables, spending more time outside, and talking to friends that I haven't spoken to in a while. Those are like small little things that could probably do a lot for me mentally and physically, that I just might not be thinking about every day because we're preoccupied by all these other things. If you don't normally eat breakfast, maybe starting to eat breakfast. I know, especially for youth, I know a lot of people who've been struggling because we're not seeing other people, like who've been struggling a lot with like hygiene and taking showers often, or even like brushing your teeth. No matter how basic of a thing it is, it really does contribute to your overall health and well-being, and doing so can also reduce things like shame. So let me see if, I don't know if I can get alerts in the, here's one. I can't see it. For some, oh, that just disappeared. For some reason, I can't see the chat. Hold on. That's weird. Okay, well, I'm gonna stop sharing if that's all right. And to kind of wrap things up, I just wanted to say thank you for having me today, and I do want to open it up to questions, because I know this was pretty short, but I do want to kind of answer any questions you might have, or if you want me to expand upon anything else, I would be happy to do that. Yeah, taking allergy meds. Yeah, just little things like that, like things in your everyday routine. Like if you normally take medications and you forget sometimes, remember, like setting a reminder on your phone to take your medication, that's an act of self-care. So it really doesn't have to be as complicated of a thing that it needs to be, or that the media perceives it to be. Yeah, I should also, Jabron says taking vitamins every day. That's a good one. I should also take vitamins. I know a lot of people who started taking like vitamin D for immune boosting and things like that. But yeah, that'll be it for me in terms of the actual presentation. I really appreciate, I want to thank Woodhull and SMYAL, of course, for giving me the opportunity to speak to you all today. I really do appreciate having the opportunity to spread this information. And I think it's really important that spaces like this, especially like nonprofit organizations, really prioritize things like bringing in outside perspectives. And it really says a lot that you all are open to hearing what others have to say and exposing people to all of that. So I do appreciate having the opportunity to share that with all of you. Are there any questions that people would like me to answer?
I was wondering if you could speak a little bit about, like, I think people in your generation are doing a much better job about talking about self-care, and like centering that in a lot of the activist work that they're doing. Even like when they're looking for jobs, like finding jobs that prioritize employees' mental health and physical health. And so I was wondering if like you could maybe talk a little bit about like how you came to those conversations. Cause I know like I didn't start hearing about self-care until I was like well into college and like burning out, and self-care came up as like a way to focus on that. But like, I don't know if that's more of like a personal anecdote or anything like that, but it would be cool to hear.
My friend Sophia said something to me last year that she is a child of therapy. And I like to think of myself in the same way. I have been going to therapy since I was like a little kid, about 5 years old. And I think that that's a shared experience in a lot of our generation. Therapy is a lot less destigmatized in our generation. Unfortunately, it's not something that everyone has access to, but I was really lucky to have been raised in an environment where I was able to see like multiple different therapists at different points in my life. So I was kind of, it used to be in the therapeutic space, like mindfulness was a big thing, and that's still a big thing today. It's kind of similar to meditation, but it can be like different things. Like I was once told to mindfully eat a raisin, which is just like putting a raisin in your mouth and like thinking about how it feels and stuff. So there's a lot of different like modes of it. But I think, I don't know, when I think about people's willingness to be open, I think honestly the internet has a lot to do with people being willing to share and talk to one another, especially young people, because a lot of people, you know, they feel more emboldened to speak on the internet because there's this illusion that you're not really talking to anyone, you're kind of just like talking to the void, which makes people a little bit more vulnerable. And when other people see like a tweet or something that they relate to, they think like, wow, I'm not the only one. This is such a common shared experience. And it encourages other people to speak out as well. So I think because we were really raised in the age of social media, we're pretty used to people being pretty open about things like that and sharing their struggles, sometimes to a fault. Sometimes there is like a problem with like oversharing or like parasocial relationships. And like the internet has also really like warped perceptions of boundaries and things like that. But I think what you mentioned is really important, like looking at different workplaces and their environments. And also, I think that's a really hard thing to do in this day and age, especially though, because everyone kind of feels pressured to put up this front of being a welcoming environment. Like I had an experience at my college, for example, where I was part of a scholars program for underrepresented students in higher education. And the idea was that it was like a leadership / support kind of thing. And it was actually very heavily discriminatory, not really a great environment to be a part of. And I worked there in that program for about 2 years. And it was just a very, very hostile work environment. And I think that that's the hard thing about now, is that you could have interactions with people from that place. You could talk to them and you could really like what they say, but you'll never actually know once you're kind of in it. And also not everyone has the luxury of being able to just go out and have this huge selection of jobs to pick from and figure out like what will work best for me. So for me personally, what I find to be the most, I guess, the best way of taking care of myself is just knowing that no matter where I am, I have the tools and like the knowledge to help myself. Especially I became like disabled like pretty early on into my college education, so I had to learn a completely new way of living. I had to learn about the law. I had to learn what my rights are, and it took being denied those things and denied basically the right to exist in a space to kind of learn how I can better take care of myself and what resources are available to me. So I think that's also really important, is like, because self-care is also self-advocacy, because sometimes you are your only advocate, unfortunately. But yeah, that's a really long way to answer your question, but there's like kind of like a lot in there.
I appreciate you sharing that. And I think even that last piece that you shared is really important, because I think sometimes self-care doesn't start until it reaches a boiling point, or it reaches a point where it's extremely necessary. Whereas like, I think similar to what you're talking about before of like self-care is self-preservation, is like the earlier you start it and build it into your routines, I think it can help those boiling points get more manageable in a way, so that you're not doing it in like a dire situation, but that like it is part of your just daily routine. So thank you for answering that.
Yeah, for sure. I really like what you said about like the preventing, don't wait for it to get bad before you do something about it, because that is really important. And also the reason that I mentioned like creating like a community culture as well is because there are a lot of things that are simply out of your control that you can like yell self-care, self-care, self-care at your employees, at your like at yourself, at your coworkers. And sometimes like if I didn't have healthcare, for example, when I was when I got sick, I couldn't just be like, I'm just gonna do more self-care and that'll, automatically fix my problems and I'll feel better, so I think that we kind of have to make up for other, like what's lacking in other areas. And what would be helpful for those people, for example, like if someone didn't have healthcare and you were in a workplace that maybe you couldn't get benefits, but they would say, feel free to take this time that you need, or have conversations about what you need from them and what you can do for each other. Because it's a lot of the times you're working for someone and you're not really working with them. And I do feel that I hope that after the pandemic, that empathy and that care for one another is not going to be lost. Because returning to normal kind of also means, because right now we're in a period of, if someone needs something or can't complete something, we say like, don't worry about it. We're in a pandemic, everyone's struggling, take your time, and people kind of use that as like, it's okay because everyone is struggling because there's a pandemic, right? And then after the fact, we can't go back to, not caring about each other and not allowing people that time, because we, and people who aren't marginalized might not feel this way, but it almost feels as if there's always, for other people who are marginalized, there is always a something, there is always something there. And I feel like just in general, we always have things going on. So that's really important as well. Like I saw on Twitter the other day, actually, after the murder of Dante Wright, someone saying, I really wish Black people could get like days off for when things like this happen because of just how mentally taxing it is. And I think things like that are really important discussions to start having with each other. Are there any other questions? It can be random or like, yeah. Because I mean, I'm sure by now, I could like talk about anything forever. Also for anyone that joined.
Last call for questions.
Yeah, I was gonna say for anyone that joined late, we were just talking about self-care, but yeah, I think is that everyone?
Well, awesome. Well, we just want to say thank you to, of course, to you, Camilla. Thank you so much for sharing your insight. And thank you to Melissa and Shelby for providing our ASL. Just a reminder that SMYAL will be hosting monthly workshops as part of the summit, and they are going to be designed by youth, facilitated by youth, for youth, and for anyone interested in learning about what matters to youth. So today's program will be up in our archives at sexualfreedomsummit.org, along with the rest of our programs as well. And we have a commitment here at Woodhull to make all of our programming accessible. And while they are free to attend, they are not free to produce. So you can also donate on our website while you're checking out our archives. And we, of course, want to let you know about our next program, which is going to be April 29th. We'll be talking about sexual freedom in the time of hope. So we hope to see you there. Thank you so much.
Bye, everyone. Thank you for having me.